Colon cancer is the third leading cause of cancer deaths, and accounting for about 8% of those deaths. African Americans are 40% more likely to die from colorectal cancer compared to Caucasians, and within Baltimore, there are disparities. We know how to prevent some of those deaths through screening, either through sigmoidoscopy, which goes up to here in the colon, or colonoscopy, which goes all the way to there. However, those disparities persist. So we hypothesized that among African American Medicare beneficiaries who reside in Baltimore City, self-reported screening for colorectal cancer by either of those techniques is associated with any of those factors: access to care, comorbid conditions, knowledge about cancer, and knowledge about Medicare benefits. This project was designed as part of a national demonstration. So these are the eligibility criteria for the people included in this analysis. These are people up to the age of 79, 65 to 79, Baltimore residents, African American. They are all insured, and since inflammatory bowel disease would make them more likely to be under surveillance through those techniques, we excluded people with those conditions. So participants responded to a questionnaire. And we looked at the proportions of people who had had colon cancer screening within the past 10 years and used univariate and multivariate techniques. We used a number of standardized questionnaire measures, as you see listed here, with references. So 3/4 of the participants are female, even though we targeted strictly African Americans from the CMS rosters, 95% self-reported African American. And this is some additional descriptive statistics for the study population that you see on the screen here. I'm going to only show you multivariate results of multivariate analysis. These are the factors that were associated with colorectal screening. Being male, one was about 38% less likely to have been screened. Having knowledge about whether or not something can be done if cancer is detected early. If one didn't know about that, one was less likely to have been screened. Having Medigap coverage made it more likely that one would have been screened for colorectal cancer. Having a provider that one sees regularly to take care of them, a regular healthcare relationship, one was twice as likely to have been screened. Having saying that it's not a problem to see a specialist when one needs to, one was 3 times overall as likely to have been screened. And here, 1.75 times more likely to be screened if one had 3 or more comorbid conditions compared to having 2 or fewer. And those analyses were controlled for a number of different factors, as you see. But what about males? This was a smaller sample of males, and we controlled for a number of factors that had been associated with screening in univariate analysis, and the only 2 factors here that were associated were having education greater than high school. The control here was having a high school diploma. Having more than a high school diploma, the males were almost 3 times as likely to have been screened, and also having 3 or more comorbid conditions. For the women, we had a larger sample size, and this is a little complicated one. One looks at cancer knowledge, specifically the question as to, knowing that you can do something to prevent dying from cancer, basically, knowing that you can do something about getting cancer. Here, the control condition is having no opinion about that. Those who say that they disagreed and those who say they agreed, these are the distributions that you see. These are the odds ratios that you see. Here, they are 70% less likely here, about 70% less likely for those 2 categories compared to no opinion. Having less than a high school education, again, they were less likely to have been screened. Having Medigap insurance, you were 40% more likely to have been screened. Provider relationships stood out here. Access to specialty care, the association is even stronger here than we saw for the general group. And again, comorbid conditions. So in this insured population, I want to stress that out. Colorectal screening endoscopy remains functionally inaccessible for some African American older adults. Screening determinants vary by gender. However, gender-based patterns may reflect in part that we had fewer males than females. Screening behaviors associated with cancer knowledge and beliefs, especially among the women. However, this relation, it appears to be complex. Thank you.